Welcome to Bolivia, to the Andean Medical Missions series Beyond 2020, the series where we look at preventing blindness in countries with developing eye care services. And today I wanted to talk about equipment that you might want to consider bringing with you or purchasing in order to be effective in screening in clinic. Let's talk about it. The equipment that you're going to require will depend very much on the style of working that you intend to do. If you're going to work in a big hospital, you're going to stay in one place and continue to work from that base constantly, then obviously you can afford to have weighty, heavy, big equipment, and that's fantastic. I'm not really going to focus on that today. I'm going to look at what you need for screening and what you need for small mobile clinics where you're working in communities where there is a hospital perhaps, or a school, or somewhere where you can set up, but there's no equipment and you have to bring your own. The question that I'm going to try and answer today is, what should you bring, what will perform well, and what are the must-haves and what are the like-to-haves? There are a few basic bits of kit that you absolutely have to have. Mainly I'm going to focus on electronics today, but you need some way of doing visual acuity. Case cards work well. This is actually just the small reading card. We normally use the slightly bigger one, but I haven't got it with me today, and that'll work at 6 meters or 3 meters either. You need to be able to eliminate refractive error, and so a pinhole of some sort. You could make one out of cardboard. We've done that before, but these are often free from pharmaceutical companies that want you to use them. And you can't be without something. If you're on your own, you need to have, well, I need to have the ophthalmology handbook. You could add, I suppose, a laptop to that as well if you want to keep a record of all of your patients in an electronic method. But those are straight away things that you're going to need. Depending on how you're doing this, so if you're going to go out house to house, then having a record of where your blind people are, so you can go back to it or someone else can pick it up, then you might also want to consider a GPS, or you could look at, and I'd encourage you to do this, have a look at the PEAK system. There's a whole resource in the PEAK system that will help you with this kind of thing. But let's imagine that you have a base and you want to bring a few things with you to make an effective clinic. Starting with simple equipment, this is a must-have. A small portable slit lamp is a must-have, and it really needs to have a slit. Something like this is perfect. I bought this from Strong Vision Technologies in the States. I have two different magnifications here. I have a green light, I have a blue light, a yellow or a subdued light, and I can adjust the brightness and the slit on here very easily. There are other options. I have also this product. This is also a slit lamp, but this is a monocular slit lamp. It's a lot more limited. It's battery operated, which is great, and you can control the slit by just pulling on this little area here. The magnification is fixed at 5, and so it's not terribly powerful, but you can pick up cataract with this. You can see the thickness of the cornea with it. You can probably pick out a corneal ulcer or a foreign body with this without too much difficulty. And then you also might want to think about something like this. This is the ArcLight system that's made in the UK. It's absolutely brilliant for screening, and it's an all-in-one little ophthalmoscope with a magnifier. The only thing it doesn't have is you can't adjust the light to form a slit, but you have a magnifier at the top here. You also have attachments to turn this into a little otoscope, which I think is quite nice. It is battery powered with a cable from a USB-C, or you have a little solar panel to go with it as well. And then if you turn the whole instrument upside down, on the top here you have your ophthalmoscope, and that has a little slider here which will change the magnification. You can also, by pressing this button here, change the color of the light, so it gives you red free, and you've also got a blue light on there for looking for foreign bodies and things like that. And it goes in, if I had a pocket, it goes in your top pocket very easily. And it's a nice system, costs about 10 to 15 pounds, I think. And we probably don't use this much ourselves, unless we're on the back of a motorbike going house to house. But it's a great gift to leave if you've gone to an area, you've worked with a set of doctors, and they seem to show an interest in ophthalmology, then you can leave this, and they can give you a call if they have a patient. You can talk them through a few things that you can do, and this is very useful in a rural setting. Next on the list is an ophthalmoscope, and you can't be without that. So this is a must-have. I have two here. This is just 100% battery powered, not very bright, not the greatest. I think I have a filter on here too. Yes, I've got a green filter on here. It's fine, but it's not the best way of looking at the back of the eye. This is a little bit better because it goes in a little charger, and it's constantly being charged when you're not using it, so the light is better at the end of the day than the other one. You've got again a filter on the front here with green light, and a way of changing magnification on here, and that's an absolute must. Very simple for detecting cataract, and you can have a look at the discs and a little look at the macula with those systems. I also have front of the eye, before we start looking at the retina in more detail, a set of loupes. This was given to me. It's a donation. It's a very nice little set. The magnification is 2.5, and this is very useful for removing foreign bodies, which with this slit lamp you wouldn't really be able to do very well, because you've got to hold the lamp in one hand, and then someone else has to hold the eyelids open, and it's not great. But with the little set of loupes, that's quite useful. The loupes is not a must-have. I've gone years and years without having a set of loupes, but it's a nice to have. And if you don't have the table slit lamp, then for removing foreign bodies, this is really super. You can lie the patient on a bed, and so they don't have head movement. Put these on, and then you've got two hands free for doing what you need to do. And it comes with a little battery, so you put the battery in your pocket, and there's also a little lamp that goes on the top to give you a bit of illumination to see what you're doing. There's no filter on this; it's just a white light. So that's sort of basic if you're going house to house or very, very remote kit that I would take. Moving on with your examination, you're going to want to probably have a better look at the discs and at the fundus. And we have here a Keeler indirect ophthalmoscope and a couple of lenses. This is a 20, and it's a nice bulk lens, and this is a must-have. I think you might be able to get away with just the direct ophthalmoscope, but you get such a nice view from this. So this is a must. You're also going to need to take pressure, and something small and portable. Again, if you don't have the tonometer on the slit lamp, then we've been using the Aviva Tonopen. It's pretty accurate, I think. I like the product. We've had it about 10 years, and we had two. The first one's just finally packed in. Batteries last about a year, something like that, so it's quite an efficient system. You do need the little covers for the tip, and we get those from Ultimed in the UK, and they're a lovely company to deal with. And this is a great little way of doing pressures. There's also the eye care system. I've never tried it. I would be interested in your thoughts as to whether you think it's suitable. I'm sure it is. It's light and small, very similar size to this. You need to buy, or you need to get the little pins, I think, to go in it, but it's a very similar concept to the little covers that come with this. I've never tried the Perkins tonometer. I just bought this and I'm very happy with this, but I know there's a price advantage with Perkins, and so that might be a consideration, because these are sort of somewhere around about $4,500, I think, now. So they are a little bit of a cost, but you can't do this without being able to take pressures. You would be wasting such an opportunity to go so far to not be able to measure pressure and to screen for glaucoma. And of course, if you're going to operate, absolutely you have to be able to identify what the intraocular pressure is post surgery. The next three items that I'm going to talk about aren't really necessary in terms of carrying with you if you're going house to house or screening with the view of bringing patients back to an operating theatre somewhere else. But they are crucial, I think, for any clinic where you're actually going to operate on cataract. So to start with, I'm going to show you our B scan. This is, interested in your thoughts. I think this is a must-have. We didn't have it for the first couple of years, but I really think that you should do a B scan. If you have a dense perception of light cataract and you can't see anything behind it at all, then you could do an operation on somebody, do a great job of the cataract operation, and then find a long-standing retinal detachment or something like that. And then you've put your patient in harm's way. They have a risk of an infection from the operation. They have some pain that they'll have gone through, when really if you had scanned properly and identified the detachment, then they wouldn't have needed to go through the operation at all. So I think it's a must-have, but as I said, we didn't have it to begin with. They're not cheap. There are other options than the one that I've shown here. There are some where you just have the probe, and you plug that into a laptop, and you get a program to go with that. I've never tried that as a system, but I imagine that if you're already carrying a laptop along with you anyway, that's quite an efficient way of doing it, and a good use of space. And then our biometry equipment. So again, from Sonomed, we have the PackScan Plus. I really like, again, this piece of equipment. It's very durable. We've had it a while. It comes with a little built-in printer at the back, and then the little probe for actually taking the measurement. Got a number of different algorithms inside, so once you've done your keratometry readings, you can put that straight in, and then whichever algorithm you want to utilize, it will calculate for you the power of the lens, both for the posterior lens and an AC equivalent should you require one. And the probe is in here just for protection. We kept it in the original packaging. And then this is our keratometer, and this is by Nidec. It's actually a bit bigger than this in total, because there's a charging port or charging base that this sits on. You can take it just on its own, and it has a big battery in here, and it will last you a while, but the base is really required with it, because this sits comfortably on the base, and you can connect a charger to the base, so it keeps going all day long. And this gives us our keratometry. It's also an autorefractor, but we don't really do a lot of refraction. At the moment, mostly what we're encountering in Bolivia is perception of light, hand movements, counting fingers type of blindness. And so, although we have the capability to make glasses, and we do at the extreme ends do refraction, but we don't really use the autorefractor a lot on this. Occasionally, maybe for high myopes or something like that, it's useful to know. But that in combination with our A scan gives us the correct biometry for the patients. There is also on the B scan, there is also built into it an A scan, and it's actually quite useful to run the A and the B scan together on it, especially if you're looking for something odd like a tumor or something like that. But it's quite useful to have that ability within this piece of equipment as well. So that's what we take with us. That's what I would consider the basics of a clinic. The elephant in the room, of course, is the table slit lamp, which does allow you to do an awful lot more. And if you have the space for it, you can buy them secondhand. They're big, they're cumbersome, and they're heavy, but they're not particularly expensive. So if you have the space, then obviously that is the gold standard. That is the best way to just examine every part of the eye. But if you haven't got the space, and weight is an issue, so if you're traveling in a Cessna or traveling carrying everything yourself, then most of this equipment here is fairly light and portable. I think the heaviest thing here is probably the Nidec at about 2 kilos, and all portable, all very good. Happy with all of these products that I've shown you today, and I could recommend them because we've been using them for a number of years with great success. That's the entire list. That's everything literally that we take, apart from the table slit lamp. If we're driving in, then we've got a bit more space and weight isn't quite so much of an issue, so we can take a few more things. But if we're flying in and with 4 people and their luggage, then we want to keep our equipment light and portable. And everything that I've discussed with you today is stuff we use all the time. I hope you enjoyed that. I hope you found that useful. I would be interested to hear if you have any additional items that you think are absolutely necessary, or if you have experience of using an alternative piece of equipment, then drop a note below and it would be good to exchange ideas. I hope you've enjoyed today's episode, and I will look forward to seeing you on the next one. If you can, like and subscribe, that's really helpful, and obviously from your point of view, that allows you to keep in the loop, keep the conversation going, and to get involved in the discussion. So thank you.